Well, another one of Weezie's Angels from the Baptist Medical Center is Juan Castro. Good to chat
How are
with
you
you.
doing?
Congratulations.
Thank you very much. It's definitely an honor. I appreciate it.
Besides that, what do you think when you're honored for what you do every day?
It's kind of unexpected. Me being a nurse for over a decade now, I've been through so many challenges, and you really try to do your best for the patient, be an advocate, and being nominated for this is very unexpected. That you know for everything that I do every day, that I want to participate with my patients, educate them, and do everything that I can for the best of them. I think this is something that we all should strive to be doing.
When you look back at the past, basically 6, 7 months, what's your best way to sum it up?
Uh, Definitely an eye opener for a lot of the newer nurses. I've been in an ICU setting before, and I think my biggest take from it is caring for my fellow nurses along with my patients, kind of coming hand in hand. So many loving, caring people that got into this profession are now put in a situation that they're seeing people very sick, and trying to help comfort them along with the patients together. It's something that I have never been through before.
It's funny because some of the other nurses that I've talked with, they've touched on that a little bit, and maybe it's the going home and talking with their spouse or their dog or something. But you were also
Yeah.
the one that I guess best way to put it is what, social director. You were arranging different
Yes.
events.
So we were isolated essentially for going to the hotel, which I am so grateful that our hospital did this for us. And so I kind of arranged for us to get a little bit of a common room, very large, so we could kind of be spread out, but share that those troubling times that we had together. You're in the situation. We're working 5 days a week with these COVID patients. You're trying to talk about and discuss things, and you're getting called by call lights or a director or a doctor, and you don't really have that opportunity to really communicate. When we come home after long shifts and we're away from our families, and even talking to your family, they don't understand entirely. Uh, when we can share that communication between everybody, in a setting where we can be relaxed, maybe order some pizza and just detox. It kind of gets it off of our heart, gets our soul a little bit uh, lifted in that aspect.
And like you said, when you have somebody that actually can say, "I know how you feel."
Exactly, and even just share that experience because we're there together. We were all in this contract together, and we can really touch on these very, very troubling situations. They became our family, these patients. They were there, we were there day in and day out. And to like this Zoom call here, we would do Zoom calls with family members, and to see them kind of degrade essentially and watch that, it weighed heavy, and we definitely needed that.
What was, I don't know, I guess what was one of the toughest things that you had to go through?
Um, the toughest thing is trying to keep your distance as far as keeping ourselves safe, to be able to take care of other patients. But when they're so scared and they can't breathe, holding their hand, essentially, coaching them to breathe, like breathe in through your nose, out through your mouth, trying to keep that panic down from them. It's a respiratory disease, and it's just so scary to not be able to breathe. And just seeing the fear in their eyes and knowing that you can't leave. And sometimes feels like you can't be in there that long, but you feel for them so heavily. You don't want to leave them.
Because that's so many times what nurses do is, like you said, just that touch, that handhold, but
Yes.
you couldn't really do it quite as much.
Yeah, you can't answer that call light quite as big. We have this thing called what was it? Where you combined all your care together, and you try to do your med pass with your food and all your care and cleaning the room and changing your lens all at one time. That way you limit how many times you go in there. But sometimes they just need that little bit of human intimacy to kind of get them past that troubling time, you know.
What's your advice for the future for somebody as far as COVID is concerned?
Definitely, this is a kind of an eye opener. You see this already in the Asian community where, you know, as a courtesy, they wear masks ahead of time. We need to kind of take that on and be a little bit more courteous to the public. You know, if you feel sick, don't go to work. You know, same thing with the flu season. People were going to work all the time. Let's not pass that on. You know, if you're starting to feel sick, maybe even wearing a mask is now something that's more common. Let's be more courteous to our fellow man, essentially.
Amen to that one. Yeah. All
Yes,
right.
sir.
Thank you, sir. And again, congratulations.
Thank you very much. It's a pleasure meeting you.
Nice meeting you too. Nice chatting with you.
Thank you.